of Radio Diagnosis to escort the dignitaries onto the dais. It is our pleasure to have amongst us Mr. Abdul Rahman Sir, Director, Kanachur Institute of Medical Sciences.
Of Radinar 2024, Dr. Bola Ramprasad Sir, HOD of Radiodiagnosis of KIMS, and Dr. Professor Lakshmikant HK, Professor of the Department of Radiodiagnosis, to welcome the dignitaries with the bouquets. Action. As we begin this ceremony, let us invoke the Almighty and seek for the blessings and prosperity that comes with it. I now call upon Dr. Sheikh Abrar Ahmed, final year resident of the Department of Radiodiagnosis, to recite the verses of the Holy Quran. We request all the dignitaries and the delegates to kindly remain seated.
Good morning, everyone. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. So these are the verses of Surah Al-Ankabut. So the recitation goes as أتلو ما أوحي إليك من الكتاب وأقم الصلاة إن الصلاة تنهى عن الفحشاء والمنكر وَلَذِكْرُ اللَّهِ أَكْبَرُ وَاللَّهُ يَعْلَمُ مَا تَصْنَعُونَ. The translation goes, recite what has been revealed to you of the book and establish prayer. Indeed, genuine prayer should deter one from indecency and wickedness. The remembrance of Allah is an even greater deterrent, and Allah fully knows what you all do. Thank you.
Just as plants require nurturing to grow, watering them symbolizes the growth, development, and learning process of a student life, which an investment needed to help students flourish and I now request the Chief Organizing Secretary of Radinar 2024, Dr. Professor Bola Ramprasad, Head of the Department of Radiodiagnosis, Kanachur, to welcome the gathering.
Good morning and welcome one and all to the third CME of Radiodiagnosis, Kanachur Medical College, Radinar 2024. I welcome our patrons, Chief Guest, Academic Council Chairman and Member, guest speakers, Principal of varied allied colleges, HODs of various medical departments, and my team, staffs and postgraduate internees, my fellow colleagues of radiology from various other institutions, and quiz participants. I also welcome the IT department, the media coordinators of various department, academic cell, account section, maintenance, canteen and caterers, photography departments. I also welcome the company Mindray, who are specialists in artificial intelligence, ultrasound, who have kept two of their higher-end machines for the display to all gathered here. My special appreciation of gesture to our Honorable Chairman of the Institute, Dr. Haji UK Mono Sir, a man with a vision and will and ability to convert rocks into diamonds, and is a pillar on taking further this institution to a deemed university. We welcome you, sir, in your absentia. I also welcome our director, Mr. Abdul Rahman sir, who is the brain behind framing the institution and a devoted son of Haji UK Mono sir, and also who has given the shine to the diamonds created by his institutional father chairman. I also welcome my teachers, chief guest of the day, Dr. Irvatur Gopal Krishna Bhatt sir, who is a legendary neurologist and a teacher of mine, and many others in this institute, and also many students all over the world. I also welcome my teachers, Dr. Mohammad Ismail sir, Chairman Advisory Council, a resource person and a gem for the growth of the institution. I welcome my teacher, Dr. M.V. Prabhu sir, member of the Advisory Council, who helps the growth of the institution. I also welcome our young and energetic Dean, Dr. Shanwas Manipadi, who is a very approachable Dean for all activities of the department. Our medical superintendent, Dr. Hari Shetty sir, we welcome you sir, and Dr. Rohan Moniz in his absence, he is the AMO of our institute. Year 2015 onwards, 10 years since I joined this institute, the radiology department has grown from X-ray, CR system, USG, color Doppler, C-arm fluoroscopy, CT scan, MRI and mammography. Now introducing cath lab for the intervention cardiology and radiology procedures. We have 6 fixed X-rays, 6 portable X-ray units ranging from 100 to 800 mAh, seminar rooms, staff rooms, museum room, intervention procedures of C-arm, fluoro, USG, CT and MR guided procedures are carried out here. Ours is the most active revenue department, which is diagnostic of a 1,500 bed hospital with 24 hours round the clock services covered by staffs and technicians, and also earning the repute of giving the best reports of all modalities in this city. Our academic activities include all department interactions and intra discussions, seminars, journal club, quiz and CME programs every year. We have MRF presentations for the first Friday of every month, which is concluded by all students of all PGs from different institutions, and our institute is having 3 PGs per year, and we are capable of handling 6 more to 9 more PGs in our department in the future. Our PGs are appearing for the first exam this year. And what is the agenda of this CME? There is no proper PG refresher course in the city happening since so many years. We have planned to introduce such an event such that covering entire body from head to toe of different systems, and each hour is taken up by different eminent speakers of the city and from nearby. About 8 to 10 cases of all the body systems will be covered in a span of 1 hour, and this will help the growth of the PG students, on also the exam going PG students, and also the internees preparing for the NEET exams. I wish all the participants of the CME, including the quiz participants, all the very best to make this event a grand success. Thank you.
Dr. Professor Mohammad Ismail sir to speak a few words.
At the outset, I would like to make an acknowledgement of all the top people on the dais, our director, Mr. Abdul Rahman, my teacher, my guru, and a teacher par excellence, Dr. I.G. Bhatt, and Dr. Venkatrai Prabhu, our dean and medical superintendent, and heads of the Department of Radiology here. Today, I am honored and thrilled to be present here because this is a process where we learn a lot of things. Radiology, from what it was to what it is, has taken a paradigm shift. When I was a student, we used to do myelogram. Professor I.J. Bhatt will know, he's my teacher. For any of the spinal cord problem, we used to do myelogram, and quite a good number of the patients were to get in for these meningitis and so on. And radiology, once upon a time, was only an imagining subject. Now it has become an imaging subject. And we, physicians and the doctors, are imagining, but you are giving is the imaging. And radiology is not only a diagnostic tool now, it has changed over as a treatment tool as well. So much so that the interventional radiology has taken over half of the job of the surgeons and other people, skilled people. And now recently you also have something called as histolysis, that is histotripsy. That is, for example, ultrasound guided, high frequency ultrasound guided removal of the lesions, for example, the liver and so on. So the radiology has got a lot of potential. It is unimaginable there where it may reach, and all you students are having an opportunity to learn. The learning never stops. From the cradle to the grave, the learning has to go on. And all you students will be having such a wonderful teachers, and they are all the inspirational teachers. And we remember our teachers on each and every day of our life, because they are the one who are our torch bearers. For example, like Dr. I.G. Bhatt. My interest towards neurology started because of Dr. I.G. Bhatt and Dr. K.R. Shetty. These are the two people who made me learn more neurology. In fact, when I was a postgraduate, I learned almost all the monograms available in neurology, including a book called Winken and Bruin, which has got about 26 volumes. Each volume is as big as the Harrison. And not only that, there are so many other things I read because I didn't have to read, but I read because these teachers made me realize there's nothing like reading and learning. It is like going to the sea, coast, and then trying to find out some pebbles. These pebbles, what you are going to take now, is going to change into gold after some time. So when I love neurology, though I don't practice neurology, because neurology is a very, very mathematical subject. If you know the anatomy, you know neurology. In the same way, radiology is also a mathematical subject. If you know the anatomy, you know the diagnosis. So today's topic is for you to learn, and it is going to make the postgraduate student who are going to appear for the exam, giving you a lot of substances which may be asked in your exam. And exam is not everything in our life. Exam is the beginning of the bigger examinations. The examiners, our real examiners, are our patients. They examine us every day. It is not that we examine them, they examine us every day. Once we fail to make a diagnosis or make a correct treatment, they will know that we are not good doctors. To that end, every day we have to learn, and this learning process, I hope, will give you a lot of benefits to you, and you have a lot of good teachers, our colleagues, and they will teach you a lot of things, and I hope you learn a lot from this. Thank you, Unsufar.
Honor and utmost privilege to invite the renowned Dr. I.G. Bhatt sir to speak a few encouraging words.
Morning, everybody. Dignitaries in the dais, my colleagues, delegates of today's CME, ladies and gentlemen. Most of the things I wanted to talk, Dr. Ismail has covered all, as usual. It's very difficult to speak after him. I thank the management of Kanachur Health Sciences and organizers of today's CME for inviting me as the chief guest for today's CME. It is widely accepted that learning is a lifelong process. CMEs provide a safe environment for dissemination and consumption of medical education. CME is crucial because it ensures that healthcare providers remain knowledgeable about the latest medical advancements and practices. Their continuous learning helps to improve patients' care, ensure adherence to current standards, and enhances better healthcare outcome. According to the American Association of Medicine, definition of CME consists of educational activities which serve to maintain, develop, or increase the knowledge, skills, and professional performances that a physician uses to provide services for patients, public, or the profession. Like all other American definitions, it is more confusing than any clear cut. CME is crucial for the prosperity of healthcare providers. It allows the students to improve on the patient care they deliver and effectively manage a career in the ever-changing landscape of medical industry. Please note that it is no more medical services, but medical industry. Radiology is one field where I have seen, as already Dr. Ismail told, maximum advances since I became a doctor. When I was a house surgeon and postgraduate student in medicine, screening and X-rays were the most sophisticated investigations because none of the district headquarters hospitals had except district headquarters hospital at Mangalore, government Venlock hospital. Other places, even X-ray machines were not there. So it was a sophisticated investigations, and the teaching for the postgraduates, someone read this chest X-ray. And if they start straight away saying it is pneumothorax, oh, you are wrong. Start with X-ray, chest PA view, trachea central, bony cage normal, like that one. So that was the teaching at that time. Now nobody bothers about all these things. During neurology students' days and early years of neurology practice, angiogram, ventriculogram, myelogram, as already told, pneumoencephalogram are used for the diagnosis of neurological problem. Some of these things you may not hear also. Particularly pneumoencephalogram, ventriculogram are nowhere to be seen. And very interesting, myelogram, when we have to do at Venlock Hospital, unfortunately, myodil also was not available. So at that time, we were bold enough to inject Conrad 280 into the spinal canal and make the patient stand vertically and shoot the films. No screening, only shooting, particularly to diagnose lumbosacral pathology, disc pathology. And if you make the patient lie down after that, one patient will go to convulsions. So he has to be sitting for another 4 hours. So it was our responsibility to see that the patient will be sitting after the myelogram for at least 4 hours. That was the problem at that time. But advent of CT scan, MRI scans, and at present PET scans have completely changed our approach. These non-invasive investigations dumped completely the earlier invasive investigations. Diagnosis has become more accurate and precise and improved the disease outcome. However, all these investigations are complementary to the clinical diagnosis. It is necessary for the radiologist to know the clinical details of the patient before reporting any unusual and rare radiological findings. It is very important to correlate clinically, otherwise it is a very dangerous thing. Now all types of diagnostic images can be acquired as digital signals, making a filmless radiology department technically feasible. MRI imaging continues to develop rapidly, and the shorter scan times and the functional to provide and potential to provide functional information is really getting importance. Recent development in use of artificial intelligence in variety of ways in radiology. Only time will tell whether artificial intelligence will take over human factor. Interventional radiology is another field where there is tremendous progress. Nowadays, interventional radiologists can take tissue from any part of the body for tissue diagnosis, particularly for the diagnosis of cancer patients. Any part of the body you tell, they will take. Interventional radiology use imaging such as CT, ultrasound, MRI, fluoroscopy to help procedures. Interventional radiology are involved in treating cancers, blockages in the arteries and veins. They are rapidly overtaking interventional neurologists in the management of ischemic strokes, aneurysms, and AV malformations, as already told by Dr. Ismail. All these interventions requires, this is very important, all these interventions requires dedication, hard work, and experience. Otherwise, they can become failures. Today's CME is mainly for postgraduates in radiology, and the agenda is quite interesting. I am sure the PGs will be vastly benefited by this CME, since the discussion is mainly around practical problems while reporting. Over-reporting and under-reporting are dangerous trends. A standard practice while reporting is a must. And you must always remember common things, because common things are common because they are very common. With these few words, I thank the managements and organizers again and wish the program all the success. Thank you very much.
Thank you, sir, for your kind
Sarve
and
jana
supportive words.
sukhino bhavantu, samasta sanmangalani bhavantu. Thank you.
It is my honor to invite Dr. Professor Shanawaz Manipari, Dean, KIMS, to
Invitees, guests, members of the media, ladies and gentlemen, good morning to you all. From the time the X-rays has been invented by William Ranjan, from the diagnosis of disease by poor X-rays to the interventional radiology, I think radiology has taken a remarkable growth, perhaps exponential growth. I'm sure with the advent of artificial intelligence, now radiology is going to push boundaries into new horizons. I hope this CME will have a profound impact on the radiological practices in the future, and I wish you a very good day. Thank you and Jai Hind. Thank you.
Chairman, Director of the KIMS, to address the gathering.
A very good morning. Respected dignitaries on the dais, Professor Dr. I.G. Bhatt sir, the chief guest of today's CAN Radinar 2024, the chairman of the Advisory Council, Kanachur Health Science Advisory Council, Dr. Mohammad Ismail sir, the Dean of the institution, Professor Dr. Shanawaz sir, Kanachur Health Sciences Advisory Council member, Professor Dr. M.E. Prabhu sir, the Medical Superintendent of Kanachur Hospital, Dr. Hari Shetty sir, the HOD, Head of the Department of Radio Diagnosis, Dr. Ram Prasad sir, the Professor Lakshmikant sir, and Dr. Director of our Ayurveda hospital, Dr. Suresh Negalguli sir, the faculties, our senior most staff are present here today, Dr. Shruta Kirti madam, Dr. Desmond, and all the other staffs of our radiology department, and the delegates who have come in a large number. Almost I have been told by Dr. Ram Prasad sir that almost 148 registrations so far. So all the delegates who have come from different institutions from the city and out of the city, warm and a cordial welcome to CAN Radinar 2024. First of all, I would like to acknowledge that today's CME, the chief guest of today's event, Professor Dr. I.G. Bhatt sir. From what I have known from little through Dr. Mohammad Ismail sir and Dr. M.V. Prabhu sir. He is one of the oldest neurologist in the Mangalore and also their teacher. And there are so many doctors who have been, he has taught and who have reached very big positions in Mangalore and elsewhere across the globe. So the Guru also, he himself was saying today that when Dr. Ismail was given the mic, he has completed all the subjects. So sir didn't have much to speak. So that way, so that shows that what great teacher he was, and the student, how fortunate they were to be have been got educated under such teachers. So today's for today's event, I deem it our extreme honor that sir has accepted to come for this as a chief guest, because we are one of the oldest, newest medical college in city, and with hardly 9 years into existence, and having the PG programs, and our first batch of PGs are going for exams. And today's CME is basically PG refresher course it is. So for this, he has agreed to come as a chief guest. It is not only our honor, it is you are one of the fortunate group of PGs to have heard from him, and also this program, which will be most beneficial for all of you, and may you reach bigger heights by acquiring the knowledge through this forum and else from your teachers, and you become an asset to the society. So I wish you all the best for this, for all the delegates, and especially our first batch of students who are going for exams, and I wish each one of you to do well, and may this kind of knowledge sharing and knowledge acquiring forum all be beneficial for everybody. Thank you, and Jai Hind.
Gratitude is the highest form of appreciation and the most exquisite form of courtesy. I welcome Dr. Taha Ismail, Senior Resident from the Department of Radiodiagnosis, Kanachur Hospital, to deliver the vote of thanks.
Respected dignitaries, esteemed guests, and residents gathered here, as we progress through this course on classic cases and core expectations for PGs, Radinar 2024, I stand before you to express our heartfelt gratitude to the numerous individuals who made this event a resounding success. To our chief guest, Dr. H.S. Ballal sir, we are honored by your presence, and thank you for your insightful words, sir. Your passion for teaching. Dr. I.G. Bhatt sir, we are honored by your presence, and thank you. Your passion for teaching and mentoring has inspired us immensely. To our patrons, our chairman, Dr. Haji U.K. Monu sir, our director, Mr. Abdul Rahman sir, and Dr. Mohammad Ismail sir, we thank you for your unwavering support and guidance. Your vision for excellence in medical education is the driving force behind events like these. To our organizing committee, headed by our Dean, Dr. Shahnawaz sir, and consisting of our HOD, Dr. Bola Ramprasad sir, Dr. Lakshmikant sir, Dr. Desmond sir, and Dr. Gurraj sir, your leadership and encouragement have been instrumental in shaping the journey of our program from inception to its execution. We also thank members of our advisory committee, our medical superintendent, Dr. Harish Shetty sir, Dr. M.V. Prabhu sir, and Dr. Rohan Monis sir. Your support has been invaluable. To our esteemed speakers, Dr. Ajit Mahale sir, Dr. Raj Gopal sir, Dr. Raghuraj sir, Dr. Devras Acharya sir, Dr. Krishna Kiran sir, Dr. Uma Maheshwar Reddy sir, Dr. Lakshmikant sir, Dr. John Roberts sir, and Dr. Vishwanath Reddy sir, your approach and engaging concepts made learning radiology an absolute delight. To the postgraduate students and organizing staff members of the radiology department, your tireless efforts behind the scenes have ensured a seamless experience for us, so we thank you for that. to the IT department, AV team, the canteen, our support and logistical staff. Your contributions have been vital in making this event a success. Thank you one and all for your contribution, support and encouragement. This short PG refresher course has instilled in us a deeper appreciation for the field of radiology. We are grateful for the opportunity to learn and grow in such a supportive environment. Thank you again, one and all. Here's looking forward to today's delightful program. Thank you.